A CEO and medical director of New Life Homeopathic Clinic. And ane minsa kana iba bechenko doc memo akwaba.
Thank you.
Bibi abokote. Yete nyamiase. Ene se yehu obi a ye birthday na ya show obi aka se nipa semesi stomach ulcer.
Medase na medenchiama UTV ahwefo nyina. Before say beka say nipa semesi ewo ulcer. You can't ulcer sa edoso. But the agidin na yenina yenim more what we call peptic ulcer.
Okay.
Na peptic ulcers no so you na hodo be miensa the and also your common ones no. The kind of what we call esophagus ulcer. And then we have what we call stomach ulcer. That is what we call gastric ulcer. And then we have duodenal ulcer. And normally within the first 11 inches of the small intestine, and and then we have visible ones like the skin ulcer. A bit me ato any. The common ones nankasa usually yataka huasem and perianajo. It's what we call the peptic ulcer. Whereby we mentioned the esophagus one, the one in the stomach, and then the one in the intestine. Okay. And then the bemiakase will be ulcer.
Okay. Now we can't also. I said the common ones, peptic nini anomkaye no. A dear pots in a deba. Then they also iba.
You can't ulcer. No cranny and cophobia perceptions. Ubia candy or nimniade. Na scientifically na dear bakwa and no dear stamp siswa ye nimse. And then it lead to ulcer. It's what we call Helicobacter pylori. Okay. Usually you're trying to short an H. pylori. And on a bacterial infection be a betna hunam ni mwa and our stomach or yefo ni mwa na abwa amana easy say any pano bit menya ulcer. Na sa bacteria we ubet by means of any contaminated food or drinks. Be a bekoni pedri any more and senke baho. And obia or non so what's our bacteria be wonimu ebia by means of an intestinal ne saliva na say wafi na bia kan ho ana sebi na janai and also be man easy say such person e betimi ama such bacteria enti sa bacteria we betena omu a the fact of the matter is obi betimi enya H. pylori for so many years and so enya ne hwe ye oni pa bi o atena omu a mo de anyi ana ye woni pa bi o ho e ba omu a e be man easy say obenya ulcer. The TNS bacteria boa ema stomach lining or wikino. Adekye Nsroma no create problem for the stomach walls. Into a basa na bibi we ye mo your friend hydrochloric acid. And na stomach walls na a generating a boa for digestion no. It because of say bacteria na ma walls no aye weak dadantino. And man very easy say acid way a best scratchy and a be peel off some part of the stomach walls. Then na bed done so. Okay. Then we say nipa we when ya what we call stomach ulcer. And only number one thing medical in the agia to say untumi nyane wrong that say H. pylori na ye main cause of ulcer. And then we have what we call as a home popoye. We be to say bia obia or tanum on some bebre. The likelihood say too much consumption of alcohol, a bit me peel off and a best scratchy. Stomach walls no na mo akonya ulcer ewo ho ana ebi mo so ye smoking and also ewo ho and then ade ba ko ne say de bia me ka say sebe wona omsem wo bie no omonnom alcohol even more than wona omuni bie no but the difference is the nsem wo bie ne be ka say watonsa papa ana side nsa papa na chi no odidi ba obi o wa oni bi enso opensanom enti the moment all no monsa too much on didino. The likely will say alcohol ne betimi create some kind of scratchy bee or stomach walls near the ewo. And
within the alcohol no, ye wo acid ni bi wo mo nti no kwa massa scratch nana.
Oh yes, of course. Okay. There can alcohol how we generate no. The substance nankasa friend alcohol no is really stronger than even the hydrochloric acid na already no stomach na acidic content are very strong
and also be kwa ka ho
and na okro ya nso oni die ubehwe na bia empty stomach no nom hard liquors enti e basa na ebetimi aboa ma na easy say scratch bi be dey e be stomach was no and a lot of but honestly speaking, there this time was so I know the okay. You never go wrong. H. pylori infection, you know. And then prolonged taking of this painkillers.
Oh, okay.
Painkillers need be a very strong. And to be a one nipa no the ane dada. And such painkillers need be so it me man very easy say stomach was no scratch be bad baby. And there will be also a drobi na onom because of our area sumesi. But because of the area we now ono now onom sendro no. Na mana ye very also a fache. Obi have a draw for over 20 years because of particular disease be a one ho. Into what's the area e bia say what be that obi a horse na me ni also ba me ye cast menya area sumesi no. Afi me yembe ye me ya me cause hospital yes menya ulcer. Into there was certain medications be and also fache bebra e mane easy say stomach was no problem bet my day
into certain medication and so you bet me dey akwa say medical condition be will be out of that ne dru a won no and e kokofa sa ulcer no so ba na.
Oh yes, you bet me aka say
okay
on say o yare sebe ana wo fedro bi e dey aso ano ana o dey treat and then only be like omo fache you would drop you away be prescribe myself 7 days 14 days and stuff
this one kwama na bro so
sir I will be cry to me fed draw particular draw be cry na e bia me fan say you can ya dia sumesi ya dia to say hypertension ya there be say diabetes and stuff no omunro ne fache because you say yourself every day it is a sabi unya ya dia no now 25 years Nana when you're 50 years chira was our federal for 25 years. Enti offer ni more no sometimes e manie easy say beboa my stomach was no problem either.
Yeah. Okay. Yes I share specific medical condition will be wa no be at na so wacha e betimi so the ulcer but side say will be obenum drone are there condition be ya reporting be or wa out of that and ulcer betimi aba.
Usually, no, you can say, yeah, dear Nankasa, sometimes it's not much of a problem.
Okay.
But a drone or fan, and a much of a problem. Because a drone one fire, dear Nebehano, until he or she don't have any choice than to take the medication. Into all fat channel, then na a bois emani easy says, Sebi, obit mania how on the stomach was no. And then a beam also like you chrome her. What we call self-medication. Obi wo ono ana droshen bottom a san or the akoto a san or akoto obi ayesa for over 5 years and who physician be na what 24 say ade ya we ebe ma problem because o share a drobi to say aspirin ne brufen na asefo na o funny too much yenim say no so one of the reason why nipa bitimenya stomach infections and stomach ulcer.
Okay. Yeah. Now you share the common symptoms. Obi o hono mo a be a yare or medical terms almost transferred pain. Be not the specific condition or one and so but talking about stomach ulcer. What are some of the common symptoms that obi nya because say we dear even though me come a diagnosis dear but meet me who say we stomach ulcer.
Sometimes net dorsum. And funny enough, any panic be cry. Symptoms of stomach ulcer no they call fry area bebre dorsum pa honestly most common ones near ebia we phone e betima ya your phone area na you mo do bebre obi dey say akeka no obi dey say sanfron no obi dey say mowe no enti eno ne dey we free ma enye and ye war no more stomach ulcer so mo yam na nka so mo ye okay normally we will be a friend epigastric pain obon say usually omunya pain or my chamber hano or my chest and no more phone in between hono te yaw more and especially the women normally omuta complaining breast pain or me no fear there's something we call breast bone and ya na also need to me hooky the breast bone na fe ama o te yawo the breast in him and sometimes to be o ha obehwe no na ma o se makoma and so na kuma ni problem bia na your stomach ulcer na ma onya that severe pain when I come home and now even what we call palpitation and then it being so diarrhea and I say bia vomiting obi o wa odidi pe eso or running and I call washroom obi also na off and sometimes we benya sa symptoms of me bo phone me ase de bia wo pese ofe ene sa ne ma no do betimi afe but the oncrophobia om de fe ne ma but de bia ofe let say wo pese ofe and then na fe obehwe no na ama or feel some sort of weakness, it be in general, the whole part of the body. And a stomach cause and so to me create a headache. Oh yes, ma. A bit mama uti ayo ya pa. A bit mama uti. Intina ya can say, a dear friend a headache, and we shouldn't joke with it. If you say, a be a win baby a free ama uti ayo ya, and also to me, inti stomach cause are there mostly no common symptoms no, vomiting, diarrhea, ne, so boba phone or yembe kikao. And now chest and ha ebeya ya and I say be ebema wa fairly weak in general. And these are the most common ones, but okay extension one it may affect your nerves. That is where you start having numbness. Okay. Until will be also until they be an
out of us and what mean numbness.
Oh yes.
Oh wow.
Also maybe many pani be brobe and they be very numb. And also to me yes sir. There are some people honestly they can feel that symptoms of or see stroke. Who say ne fire numb and so then stroke as wow. The moment I benya access on your nerves no ever start to say ma that numbness ne tingling na say the panie bi body name. And those are the extension ones, but when you want to talk about the main symptoms there is basically the vomiting, diarrhea, and no ya unya pain wo upper side no chest and throughout in the ceremony.
Possible say out of a stomach ulcer no betimi stool we jana eni betimi asesana. Oh
yes na no na dru ho a na dru baby e hu kakra
advanced stage
oh sebe eno dru ho a no kwasmom ni say we rough betimi kra ku there's a ulcer na breeding.
Okay.
So what you say?
Moja need to chronomo no moja
no. Also need breedy. Into a basa na ebema sebe wa janai no. I had to say coffee color be. Into na say also na a breedy.
A bleeding.
Na into say a basa na say well hune nipa ni nim ho hwe. No de ni hwe ne saa sebe betima mo ahwero nkwa.
Not just a very important now. No, Uja on so perry. So perry.
Yes, it's very. But honestly,
I mean,
as a
yeah.
Oh yes, as a
for safety sake,
because sabi, one shall blood won't grab it.
And again, no, so no, a better possible symptoms are yabosu in no. A possible be these symptoms and so no also.
Oh yes, of course. Oh, say. Yeah, cancer symptoms, but there are some people symptoms no onya. Maybe once in a while now when you flash be, but enya dia hotel huni bebre. There are a lot of people who live with stomach ulcer, which you call gastric ulcer, or because of how omode shisha yare bi obi or the akwasha na kuma, obi or the akwashewe. Until the moment e ko that way ne dear, e mani sometime bit my hiding the panel and no dey hosa but do na ehu we saw also no kind of diagnosis now after say be a test we can take your sebi wajana ye bit ma fa umoja but the ultimate thing to confirm ulcer is what we call endoscopy and no na ye near they confirm say a crow abeto we your phone.
Okay. Yeah, show people how with the pain no. Obi betimi nya excruciating pain pa wo je ne ho nje because say me nidi ye but the moment eduane to me yemu no me te ye opa ye beka say didi a won didi ye no ene ede sa pain no e ba na say yare no onsa na wo honom na nti ene de sa ya wo na ba
ni nyina ne say nipa na nkasa wo hwe ne ye fon na ye mfa ne say ekro wo ana a chronic word no stomach was no still a generate hydrochloric acid. Especially unya resawa no pe na body na ye ready say bibi ba so enti ebasa na acid na dose no na say aduane bia ankwa ebema wo ye fom ayede ayewoya enti ye wo nipa ni bia because of stomach ulcer o didi no wadidi awie no na afe na ye fom no eye ne ya depending aduane kra wo ye dey odi ye ebi kro no angasa kro no nya we so ulcer ba odi particular food bia no say no de me yefun ye me no me mpe ane wo wona omudo benya pain no emre kro aduane kra nya dai enko mo yem enti e osane obia stomach no ebe react afa na be mo hu say wadidi awie na benya yawo no ana say unidi na benya yawo no but most of times no one attach rom ho kom no because of say acid level near high ntino eboa ema near very easy say unidi ya ubenya such pains.
Such pain. I see. Ye can also say me ewo nkrofo eye wo mo etimi ye mofra eye painful eye ma na within sa nkrofo eye wo mo no hefo pana wo mo de e wo soro. As
a matter of fact, ye can infection called Helicobacter pylori na ye fa mostly ewo nkwala brim.
Oh.
And that is a fact.
As a my job no man form no moon futuro ko mo num.
Then we end up saying so we are about frying and shade. No, a one na normally a picky germs in bacteria be. Into a wabo friend him no di meaning is a akwala to minya ulcer. Penny to minya ulcer. And a sebi a branty ababa obia to minya ulcer. But it become very obvious. Emra ni pano esa ye near mebia your phone empe.
You know the cabo boss.
Your phone your crow. It's good. Also sorry, I bet no sasa only di now smoky a basana ya will be a friend triggers because of say crony or na also pedrian no na ensana on na bema or sana your words and I will be all smoky and also bema na words enti ye wo how ni pedriana or sana hano no or titini ye phone fa na bema na say be hano more ana hano so usually let me abofra branch penny obia and mostly no na a dead row so for longer period of time. Yeah, sure. Wow.
Ene obi or so is obi obese cramp na or so me some diet said the bear menye kese emro na menye kese bebre. Yesha also no ye betimi the dietary aspect ama changes abana. For instance, obi no monsa be also una feel now we decide to say on no monsa ne bi obedidi healthy. Out of that no e betimi ama also na kwana.
No cranny, you can't also diet today into me from and not dear because you will be a friend of hot condiment and hot spices. No, your spices be okra or also you got to be careful with it. So you crow or yam dada. Okay. Also, udinema and no she.
So moko no ne ade we also yam
no, but as I say, what so. Okay. Yanka say jadi garlic ne pepper ne sa ne mano unya also there's no need say obeka say mejadi but obetimi ateso enti obi a owo ulcer na we hu say no ene alcohol nko mejai smoking enye mejai ene sebe hot spices ne na me tweme ho ayedai every ho no ebe boa ma yawo na wote na ayedai abafom eno dey fact na emom enya koba se krona ba uhia medical treatment.
Okay.
As I say, it me treat ma de any free ho. Na free ho momo na fe wo de die through na e dey. Aka ho. Sebe ya ensa me how. So what I say.
Na follow up na best way ye de treat ulcer enye dietary nko.
No, enye no nko a. O ye dan ya de na aba no bacteria no ntimi fa dietary nko no. Yes, so aboa bi wo yam ye kan bacteria ya aboa. E friend H pylori or shaw yam. It is also be the year on to me.
Some of one was into the coach share one and say,
can the rock or
no, what's me. Now, there's this, I don't know if it's a myth, dear. You say, oh, also, citrus family, no, orange, lemon, men could decra. No,
question we here. No, crowd, say. Citrate foods no the moment a core system it turns alkaline.
Oh, okay.
You can alkaline so and also one of the substance a boa suppressive hydrochloric acid. At acidic level no so I won't pedrianim. Indirectly na problem. So what I say. But whereby I'm a war stomach ulcer no. So mean didi and say me could di citrate food beer and some of the main food. Until I say me wo ulcer into crow me yam into ense say my fasting me could the orange and a pineapple me yes I friend triggers ebema wanya ye funke kakakra but so what didi now be the pineapple no the orange and no ne ma ulcer no enye ne hwe the tia ne say sometimes so na ho e bit ma be say bibia twa where hu say ye nipa e bia na later akom say tambe na me pray e bia na mfifre na afam na ahyehyew no akohwe. And it doesn't mean if you friend na trial. There be no na aboa mo hu say wepra. It the same way na say wodi bibi na ema yefon ye wo ya adekodi ni mom na aboa mo se kro wo yam senti ase wo enti ye cancer citrate foods na say wo ulcer uni ulcer obetimi adi nanso de owo ulcer no ohu time we say so e dey odi no because many ulcer na ma wie me fasting na me si medi we anywhere even ideally cry no uni ulcer cry na so watching yam mo comfort the whole day and advisable so this citrate no be started because already there's a lot of chemical acid in the stomach and alcohol top it up but the entire creative problem here the moment it goes there it turns alkaline into a problem here to bet me but just watch time in time
okay now no so be a was yen share a diagnosis no your blood and I know just your call yem baby rahon san detectors so
definitely there is a room
okay
but best started by your foul blood sample
okay
and then I de cohese sa bacteria called H. pylori na bi owa and then you betima fa sabi wajana so and also a hot pan here more open the correct way to detect sa Helicobacter pylori na uhia jana no ehu hia pa and blood sample but whereby sabi jana no visibility near problem you can use blood no which is okay na ya we na confirm no say maka say aboa no betima wo biem enso na osamai
no onim ko se ko se be be dormant eso on ka na ho so no hye ho
enti obi ho de benyin enye ne hwe but aboa no de ohye ne ani owo obi on so won yam na epra no what bacteria and so o wiki stomach walls na mania is say acid be peel off na corona dey aba enti ekoba say suspect symptoms na o dey ba no ene de ho ye o no yasa hu H. pylori the buane say yeah what you call endoscopy.
Okay.
And no na me say be call yam. There's a procedure where this you pass something through your stomach, your mouth, then it goes through to the stomach. I say the correct say no crese nipa no ono de ne kro no aba.
Camera bi na mo de hwehwe
that is what we call the endoscopy.
Okay.
Because people usually confuse gastritis with stomach ulcer. Because gastritis is bit me amount similar symptoms. And so no kro any ho
okay
gastritis usually and critical
and also no so betimi am gastritis no so symptoms and so na
that is how come endoscopy to confirm because be am symptoms am dey aba no we did the same thing aba but me dey necronym yam but we crow yam but how can we identify say until no na basa na we do the endoscopy to confirm. So okay, we dey necrom, but papa we dey the acronym. Then we know say we be there gastritis, but you know gastritis usually come with this gas, will be bechi bebre, el san, and from a year bebre ne, or fwa kutu. So gastritis usually comes with those kind of gas thing, which is very unpleasant too.
Okay, yeah, sharp the period it's me at the say ho yare. If we ulcer ho it take time and is a monthly thing and I say be it take years and say it me treat
and say take years it dependent procedure any panel e treat ulcer no usually out there no there are some antibiotics are omutime prescribe and there were other medications are obedi me many panel it descend the panel dey be call within 2 weeks within a month depending a drokra doctor and a physician atoso. But like I said, fair draw. Ebia ye 2 for so dear way, we ya a bema na ye west. Into a western no a bema draw no cry efficacious no aba form. Into as I say what and what you balance with the medication. Into ye shed the need duration of treatment say 1 week, 2 weeks or 1 month and say also echo. It depending treatment to craft physician atoso and a bema so within a week echo. By infancy trim say ulcer na treatable. But ya manako say you done in a chronic condition. Treatable. Treatable pa. But ya manai to say obi betima ba onchen ye diagnose him say me ulcer 15 years ago akane ho.
As I kwankro.
Sa.
But enya
kwankro. And say basa. As I say it me treatment ko. But say o dey nkwa then you have to watch the obusa no or dietary nema we ye wo fie ho a ebi ekroni wu now the bibi ko why ekroni wu enti eba sa enko
okay
and that is the situation.
Okay, so there's a possibility say ye treat you but ade a wo kodi no esen kwa kwa wesen ekuro.
Oh yes
nti ye be treat you a ye yi wo free often say niema bi ho ayenko kosan ko wai kro no any ubo antibiotics eso and aside no ye can ye ba o domain mo use antibiotics and asem another approach amode
yes as a homeopath no I don't use antibiotics.
Okay.
Yenso ye wo remedies ye de ko ade a friend stomach ulcer being the gastric ulcer in the stomach, duodenal ulcer in the intestine, esophageal ulcer, ninyina yenso ye wo ye remedies ye de ko ye de boa emani free ho na nipa na nya ne freedom. Nti na education wise no what we know publicly no is the orthodox one how they do their procedures. But oba yen ya femo na as a homeopath no yenso ye wo ye remedies ye de ko ye de a friend said ye ulcer emani nipa na nya ne freedom kra.
Okay. Ye ba sorry so anasa obi te honom or ulcer. Now pay attention to it. What are some of the consequences and I think so no preventable then so na yenya yemfa prevent it.
No kwasem ni say ye betima prevent ulcer. O hwe kwan a ye fa so nya the bacteria called H pylori na ma chiro say be fin na de ba. Contaminated food or drinks e betimi am wanya sa bacteria no. Nti o hwe de wo nom ene de wudi here sebe wa prevent it in a way. Ana sebe kwan ba ko a eno so ha adwen. Won say situation na ye fa so nya typhoid no. Sa na ye fa so nya sa bacteria Helicobacter pylori no. Nti ase obi ajanan aba wo ho ana aka wano. Nti be buza how possible but it's possible. Ye wadwumam obi akoye ne ho yie wan fa sopa ro ne nsa. Owi o de akoso door handle nim. Onso wi akosom. There are so many ways. Ebi obi di bibia ye wakono ma mini ba ko e. As make can be a free ban one was shown say ye. Betima ma aduan na contaminate ama bacteria e dey aba wo yam. Nti ye hwe ahonidie efam yie a in a way ye prevent ulcer no. And e bie mo so no. Ye ka say treatment side na e ade a the moment I am wadro no so hwe so far e boa ma wo de wo ho. But one hwe so anfa the serious consequences de akire no e ye de obetima hwere wo nkwa.
No to ulcer no obetima nya cancer.
Yes.
Okay.
Yes. Okay. Yes. Stomach ulcer can lead to stomach cancer.
Okay.
And you see that.
Okay.
Yeah. And you can imagine say ulcer better than cancer. Then not say oh yeah ko baby a hot tropa. And anya cancer ne kra na the moment I be hu say private ne kala asesa na say ulcer na breedy. Nti no so say ulusu moja. Nti utranye ya by means of that no betimi so ahwere wonkwa. Nti yan fan shit him say ulcer so ekum.
Okay. No, my number to Joe. Patients, Eddie, say I'm a breast cancer survivor and duodenal ulcer. Kindly help me. Patient, doctor, then a number to Joe. Then now you follow up account. So be episode back or one which one number. That's
it. New Life Homeopathy Clinic. I will dance man runabout. We do dance man first runabout in a Frebe King Solomon. A 1 year. I will dance man Accra. And I come and say what Atasimanso. Aye ben taxi station no enti number baby obi a nam bia betimi afre na oni me adi nkomo concerning us and bibia how adwen bia 0244 09 35 95 0244 09 35 95 and 020 33 35 439 020 3335 into where my numbers are obi afra baby and nipa na obi a obenya me ankasa kra na me ankasa.
Okay, doc here that's pa wo checha wo dia mai nei yenya eye encheche sei dia na chese hwe didie mu eyi pa wan fa wo pe enkonom aduro na wo environment any dia wo bedi no so no make sure say a healthy and clean. It's Dr. Adekye J, CEO and Medical Director of New Life Homeopathy Clinic and the NHN Komo FA causes and treatment of stomach ulcer. Sabri ye da ye ho tiawa Adekye Nsroma gusoa e wo homa ye beba sisia.